Hi viewers, welcome to ChemEasy. In this video, let us discuss about vasodilators. This is one of the drug class under anti-anginal drugs. To know the complete classification of anti-anginal drugs, watch classification of anti-anginal drugs video already uploaded in this channel. And before watching this video, subscribe ChemEasy to learn chemistry easily. This is a brief introduction about vasodilators. Vasodilators dilate the blood vessels. It means the term itself, dilators, is included. You can understand easily. It dilates blood vessels and it affects the muscles in the walls of the arteries and veins so that it prevents the muscles from tightening and also prevents the walls from narrowing. As a result of this, blood flows more easily through the vessels so that the heart doesn't have to pump as hard and reduces the blood pressure. The subclasses under vasodilators are nitrates, nitrites and miscellaneous, that is non-nitrate. Again, the nitrates are classified into short-acting nitrates and long-acting nitrates. Short-acting nitrates, example, glyceryl trinitrate, that is nitroglycerin, and under long-acting nitrates, isosorbide dinitrate, isosorbide mononitrate, erythritol tetranitrate, Penta erythritol tetranitrate. Then under nitrites, the available drugs are amyl nitrite, sodium nitrite and sodium nitroprusside. Then the non-nitrate includes dipyridamole. This is a general mechanism of action of nitrates. Organic nitrates lead to the formation of the reactive gaseous free radical nitric oxide and related nitric oxide containing compounds. Nitric oxide can activate guanylate cyclase, then increases the cellular level of cyclic GMP, activate protein kinase G and modulate the activities of cyclic nucleotide phosphodiesterases. In smooth muscle, the net result is a reduced phosphorylation of myosin light chain, reduced calcium ion concentration in the cytosol and relaxation. Now let us discuss all the important drugs one by one in detail. First one is glyceryl trinitrate, that is nitroglycerin. Here the structure of nitroglycerin given, and chemically this glyceryl trinitrate is 1,2,3 propane triol trinitrate. Nitroglycerin can be synthesized by nitration of glycerol with nitric acid in presence of sulfuric acid. The reaction is shown here. Glycerol with nitric acid and sulfuric acid, which is nitrated and gives nitroglycerin. Nitroglycerin acts by this mechanism, that is the nitroglycerin is converted to nitric oxide. This nitric oxide is an active intermediate compound. It activates the enzyme guanylate cyclase. This guanylate cyclase stimulates the synthesis of cyclic guanosine monophosphate, that is cGMP, which then activate a series of protein kinase dependent phosphorylation in the smooth muscle cells. Results in the dephosphorylation of the myosin light chain of the smooth muscle fiber. Subsequent release of calcium ion results in the relaxation of smooth muscle cells and vasodilation. Now let us see the structure activity relationship, that is SAR of nitroglycerin. In a cell-free system, the potency of organic nitrate for guanylate cyclase activation is mainly determined by the number of nitrate groups. It means in glyceryl trinitrate there are 3 nitrate groups. Since nitrate induced activation of guanylate cyclase involve the formation of nitric oxide free radicals, potency therefore increases as nitric group increased in the group. increase in lipophilicity due to esterification of the free OH group in isosorbide mononitrate had no major influence on the guanylate cyclase activation. Next one is metabolism of nitroglycerin. It undergoes hepatic metabolism. Cytochrome P450 is a key enzyme of organic nitrate biotransformation. Nitroglycerin is degraded in the liver by reductive hydrolysis reaction and partially in plasma by spontaneous hydrolysis. Majority of urinary metabolites of nitroglycerin include glyceryl mononitrate, 1,2 glyceryl dinitrate and 1,3 glyceryl dinitrate. Reductive hydrolysis in the liver by hepatic inorganic nitrate reductase leads to the formation of nitric oxide radical. These are the structures of major urinary metabolites of nitroglycerin, that is glyceryl mononitrate, 1,2 glyceryl dinitrate, 1,3 glyceryl dinitrate. Next one is adverse drug reactions of nitroglycerin, that is ADR. Common ADR includes headache, hypotension, tachycardia, dyspnea, dizziness, blood vision, lightheadedness, flushing, nervousness, and xerostomia. Serious ADR includes methemoglobinemia. This condition is rare. Then syncope, prolonged bleeding time, exfoliative dermatitis, unstable angina, rebound hypertension, and thrombocytopenia. Then therapeutic uses of nitroglycerin includes this nitroglycerin is administered to relieve anginal chest pain and to manage blood pressure through vasodilation. Different preparations of nitroglycerin may also be administered for treatment of renal issues, liver issues, and even as ointment for anal fissures. Second drug under nitrates are isosorbide dinitrate, that is ISDN. Here the structure of ISDN is given. We can draw like this or in this form. Both are same only. To synthesize isosorbide dinitrate, first the D-sorbitol treated with para-toluene sulfonic acid, it gives isosorbide. In next step, the prepared isosorbide undergoes nitration with nitric acid and sulfuric acid mixture and gives finally isosorbide dinitrate. Mechanism of action of ISDN. Isosorbide dinitrate, which is a nitric oxide donor, relaxes smooth muscles via dose-dependent dilation of arterial and venous beds to reduce both preload and afterload as well as myocardial oxygen demand. This also improves the coronary collateral circulation, lowering blood pressure, increasing heart rate and causing occasional paradoxical bradycardia. Structure activity relationship of isosorbide dinitrate. Isosorbide dinitrate relaxes vascular smooth muscle by formation of the free radical nitric oxide, and this nitric oxide activates guanylyl cyclase, thereby increases the synthesis of cyclic GMP within smooth muscle, resulting dephosphorylation of light chain myosin and relaxation of peripheral arteries and veins. In addition, this drug relaxes coronary arteries, thereby increasing the blood circulation through ischemic area. Next one is metabolism of isosorbide dinitrate. Biotransformation of organic nitrates is result of reductive hydrolysis, which is catalyzed by hepatic enzyme glutathione organic nitrate reductase. Enzyme converts lipid-soluble nitrate esters into more water-soluble denitrated metabolites and inorganic nitrite, organic nitrates. After intravenous or oral administration, primary metabolite in plasma is 5-isosorbide mononitrate. So here the structure of 5-isosorbide, that is the metabolite, is given. Adverse drug reaction of isosorbide dinitrate includes in cardiovascular system rebound hypertension, which is uncommon, syncope, unstable angina, flushing, hypotension or orthostatic hypotension, lightheadedness, palpitations and tachyarrhythmia. In case of central nervous system, dizziness, headache, restlessness and weakness. In gastrointestinal tract, nausea. The therapeutic uses of ISDN includes this drug is used to prevent chest pain, that is angina, in patients with a certain heart condition, that is coronary artery disease. And these drugs works by relaxing and widening blood vessels, so blood can flow more easily to the heart. This is third drug under nitrates, that is penta-erythritol tetranitrate, and this is the structure of penta-erythritol tetranitrate. Mechanism of action of penta-erythritol tetranitrate includes this drug releases free nitric oxide after the denitration reaction. This released nitric oxide triggers nitric oxide dependent signaling transduction involving soluble guanylate cyclase. Nitric oxide binds reversibly to the ferrous heme center of SGC, that is soluble guanylate cyclase, causing conformational change and activating the enzyme. This enzyme results in increased cellular concentrations of cyclic guanosine monophosphate, that is cyclic GMP, within the vascular smooth muscle, resulting in vasodilation mediated by cyclic GMP dependent protein kinases. Penta-erythritol tetranitrate is extensively metabolized in the liver, and the metabolites includes penta-erythritol trinitrate, penta-erythritol dinitrate, penta-erythritol mononitrate, and finally penta-erythritol. Therapeutic uses of penta-erythritol tetranitrate is this drug is used prophylactically to reduce the severity and frequency of anginal attacks, and usually this drug is administered in sustained release preparations to increase its duration of action. Next drug is amyl nitrite. So this under nitrite category, and this is the structure of amyl nitrate, which is nothing but 1-nitropentane. Mechanism of action of amyl nitrite. Amyl nitrite causes a non-specific relaxation of smooth muscle, with the most prominent actions occurring in vascular smooth muscle. This effect on vascular smooth muscle results in coronary vasodilation and decreased systemic vascular resistance and left ventricular preload and afterload. Myocardial ischemia is relieved in patients with angina pectoris with an abatement of chest pain and possible other related symptoms. Amyl nitrite inhalant or absorbed rapidly through the pulmonary alveoli shows therapeutic effects within 1 minute after inhalation. Amyl nitrite is metabolized hepatically, and the drug is metabolized rapidly and probably by hydrolytic denitration reaction. Approximately 1/3 of the inhaled amyl nitrite is excreted in the urine. The therapeutic uses of amyl nitrite is this drug is used to treat the symptoms of acute relief of angina and cyanide poisoning. And the drug may be used alone or with other medications. The last drug is dipyridamole. This is one of the non-nitrate coronary vasodilator, and here you can find the structure of dipyridamole. Mechanism of action of dipyridamole. Dipyridamole inhibits the cellular reuptake of adenosine into platelets, red blood cells and endothelial cells, leading to increased extracellular concentrations of adenosine, which is a potent vasodilator. And dipyridamole metabolism takes place hepatically. It is slightly bound to plasma proteins and is metabolized in the liver, where it is conjugated to a glucuronide, and this is excreted in the bile. Therapeutic uses of dipyridamole is it is approved for secondary prevention of stroke when it is combined with low dose aspirin, and this drug is a long acting vasodilator. Its vasodilating action is selective for the coronary system, and the drug is indicated for long-term therapy of chronic angina pectoris. If you like this video, share with your friends and subscribe ChemEasy.